Hi, Brenda with the Hospice Care Plan, and briefly on pain management. I think we really is something that is very important to address and address quickly on hospice, because people are at the end of their life. They want the best comfort and quality of life with the time that they have left. And pain can come from disease process. It can come from just the aches and pains of aging. It can be emotional. And pain is a very complex thing, and pain and anxiety feed each other. It's important to be honest about what pain you're having where, and if you can articulate it, just try and express it the best you can. For dementia people, they can't always express their pain, and so we really have to use our observation skills. And I think the important thing is that you're going to need some medication likely at the end of life to stay as comfortable as you can. That doesn't mean you're going to become sedated. Hospice is very good at using the right medication at the right amount, which is the smallest amount. And what we know is when we treat with pain preventively, we tend to get away with a little less pain medication. Any side effects, we can deal with that. And I think that just acknowledging that there is discomfort and not just pain is important. We use long-acting and short-acting opioids. We also use steroids, non-steroidal anti-inflammatories. There's lots of ways. We address pain in a multifaceted way. And we often address the emotional pain that comes at end of life that feeds that physical pain. So please work closely with your hospice team to best manage your pain or discomfort, and you can find our care plan booklet and get more information at thehospicecareplan.com. And please feel free to ask us questions about pain management on our YouTube site. We'd love to answer them. Thank you.